This video is for educational purposes only and is not intended as medical advice. Please consult a qualified healthcare professional before making any health-related decision.
Every time your feet strike the ground, a silent force travels upward through your ankles, knees, hips, and spine. In youth, that force is absorbed almost effortlessly, like a wave dissolving into sand. But in later years, the same wave can feel less forgiving, less absorbed, and more deeply imprinted into the structures that carry you through life. High-impact exercises such as jumping routines, plyometrics, or aggressive step aerobics are designed to harness explosive power. They rely on rapid muscle contraction and repeated ground reaction forces that can equal several times a person's body weight. In a younger body, thick cartilage cushions the ends of bones, synovial fluid provides smooth lubrication, and bone density offers structural resilience. The system is built not only for movement but for shock absorption. However, as the decades pass, this shock-absorbing system changes in subtle but meaningful ways. Cartilage, the smooth tissue that lines joint surfaces, gradually loses some of its elasticity and hydration. Its ability to distribute force evenly becomes less robust. Synovial fluid may decrease in both quantity and viscosity, reducing lubrication inside the joint capsule. Meanwhile, bone remodeling continues, but for many seniors, particularly postmenopausal women, bone density may decline. These biological shifts are not signs of weakness, they are natural adaptations of aging tissue, yet they reduce the margin of tolerance for repetitive impact. When a senior performs repeated jumps or high-intensity step routines, the compressive and shear forces on the knees and hips increase dramatically. Microtrauma can accumulate in the cartilage and subchondral bone beneath it. Unlike muscle tissue, cartilage has limited blood supply. Its capacity to repair is slower and less efficient. Over time, persistent mechanical overload may accelerate degenerative changes, contributing to osteoarthritis. The process is rarely dramatic at first. It begins quietly, mild stiffness in the morning, subtle swelling after activity, a sense that recovery takes longer than it once did. The spine is not immune to these forces. Each impact sends vibration through the vertebral column. Intervertebral discs, which act as shock absorbers between vertebrae, lose water content with age and become thinner. Repeated compressive forces can stress these discs, potentially aggravating existing degeneration. For individuals with osteopenia or osteoporosis, high-impact movements may even increase the risk of stress fractures, particularly in the hips or lower spine. It is important to understand that impact itself is not inherently harmful. In fact, controlled loading of bones stimulates osteoblast activity, encouraging bone maintenance. The problem arises when the magnitude and frequency of impact exceed the tissue's adaptive capacity. Aging does not eliminate the body's ability to adapt. It simply narrows the window within which adaptation occurs safely. Recovery processes become slower. Inflammatory responses may linger longer. The same exercise that once strengthened may now outpace repair. There is also a neuromuscular dimension to consider. High-impact routines demand rapid coordination, quick reaction times, and strong eccentric control, the ability of muscles to lengthen while under tension. With age, reaction speed declines subtly. Muscle mass and power output decrease, particularly in fast-twitch fibers responsible for explosive movements. When neuromuscular control is compromised, landing mechanics may become less stable. The knees may collapse inward slightly, or balance may falter momentarily. These small deviations can amplify joint stress and increase injury risk. None of this suggests that seniors should avoid movement that challenges them. On the contrary, movement is essential for maintaining independence, metabolic health, and psychological well-being. The distinction lies in how force is introduced to the body. Low-impact alternatives, brisk walking, cycling, swimming, elliptical training, provide cardiovascular benefit without repetitive pounding. Even strength training, when performed with controlled tempo and proper alignment, can stimulate bone and muscle safely. The body thrives on load, but it prefers load that is progressive and intentional. There is also a psychological layer. Many seniors carry the mindset of their younger selves. They remember the exhilaration of high-intensity classes, the satisfaction of pushing limits. Identity can become attached to intensity. Yet wisdom in later life is not about abandoning effort. It is about recalibrating it. The goal shifts from performance to preservation, from explosive output to sustainable vitality. Choosing lower-impact movement is not surrender, it is strategic adaptation to biological reality. When we consider exercise recommendations for older adults, we must think in terms of tissue tolerance, recovery capacity, and long-term joint integrity. A single jump may not cause harm. Even a short period of high-impact training might be tolerated by a healthy, conditioned senior. But repetitive, high-frequency impact, especially without adequate conditioning or medical clearance, increases cumulative stress. The consequences often emerge slowly, appearing as chronic knee pain, hip discomfort, or worsening degenerative joint changes over years. The aging body still desires stimulus. It still responds to mechanical challenge. But it does so best when the stimulus respects its structural evolution. Gentle progression, controlled mechanics, and attention to post-exercise recovery become more important than intensity alone. Warm-ups grow more valuable. Rest days become protective rather than indulgent. Listening to discomfort early can prevent disability later. Ultimately, the conversation about high-impact exercise in seniors is not rooted in fear. It is rooted in biomechanics and physiology. It is an acknowledgement that tissues change, that resilience transforms, and that longevity depends on thoughtful choices. Movement remains medicine, but like any medicine, dosage matters, timing matters, and the individual's condition matters. When exercise is selected with awareness of cartilage health, bone density, and neuromuscular control, it becomes a powerful ally in aging. When chosen without regard for these factors, even something as repeated jumping can quietly undermine the very independence it was meant to protect. There is a particular pride that comes with lifting something heavy. It reassures us that we are still strong, still capable, still anchored in our physical power. But strength in later life is not measured by the weight on a barbell. It is measured by how well the body tolerates stress and how completely it recovers from it. Heavy maximal lifting, the kind that pushes muscles to their absolute limit, has undeniable physiological benefits when performed appropriately. It stimulates muscle fibers, enhances neuromuscular recruitment, and can slow the progression of sarcopenia, the age-related loss of muscle mass. However, when seniors attempt near maximum loads without proper supervision, progression, or medical clearance, the internal strain placed on the cardiovascular system and spine can exceed safe thresholds. When a person lifts a very heavy load, the body instinctively performs what is known as the Valsalva maneuver, a forceful exhalation against a closed airway. This stabilizes the core and protects the spine in the short term, but it also sharply increases intra-abdominal and intrathoracic pressure. As pressure rises inside the chest cavity, venous return to the heart temporarily decreases, and blood pressure can spike dramatically. In younger individuals with elastic blood vessels and robust cardiac reserve, these fluctuations are often well tolerated. In seniors, however, arteries may be stiffer due to age-related loss of elasticity and atherosclerotic changes. The heart muscle itself may also exhibit reduced compliance. This combination means that sudden blood pressure surges during maximal lifts can place extraordinary stress on the cardiovascular system. For individuals with hypertension, coronary artery disease, or undiagnosed vascular conditions, the risk becomes more pronounced. The issue is not that resistance training is dangerous, it is one of the most protective forms of exercise against frailty, but that intensity must align with physiological capacity. Controlled resistance improves vascular health. Excessive strain may provoke complications. The spine presents another layer of vulnerability. Intervertebral discs gradually lose hydration and height as part of normal aging. Ligaments that support spinal alignment become less elastic. The cumulative effect is reduced shock absorption and less tolerance for compressive and shear forces. When a senior attempts maximal deadlifts, squats, or overhead presses without refined technique and appropriate load management, the compressive force transmitted through the vertebral column can be substantial. Under heavy load, even slight deviations in posture, a rounded lower back, uneven hip alignment, insufficient core engagement, magnify stress on discs and facet joints. Younger tissues may compensate for technical imperfections. Aging tissues are less forgiving. A compromised disc can bulge or herniate more easily when subjected to extreme pressure. Vertebral end plates may experience microdamage. For individuals with osteopenia or osteoporosis, the risk of compression fractures becomes a legitimate concern. There is also the matter of connective tissue adaptation. Tendons and ligaments adapt to loading more slowly than muscle fibers. With age, collagen structure changes, and blood supply to these tissues is relatively limited. Heavy lifting that progresses too quickly can strain the supportive structures beyond their ability to remodel. The result may be tendonitis, partial tears, or chronic joint instability. What begins as an attempt to build strength can inadvertently create pain that limits future activity. Recovery is another critical variable. After intense lifting, the body initiates a cascade of repair processes: inflammatory signaling, protein synthesis, and hormonal modulation. In seniors, anabolic hormone levels, including growth hormone and testosterone, are generally lower than in youth. Protein synthesis still occurs, but at a slower rate. Sleep architecture may also change, affecting overnight recovery. When heavy sessions are repeated without sufficient rest, the cumulative stress can outpace repair, leading to persistent soreness, fatigue, and increased injury susceptibility. Yet none of this suggests that seniors should avoid resistance training. On the contrary, strength training is one of the most evidence-based interventions for preserving independence, improving insulin sensitivity, and maintaining bone density. The distinction lies in load selection and intention. Moderate resistance performed with precise form and controlled breathing stimulates muscle fibers effectively while keeping blood pressure responses within safer limits. Submaximal loads lifted with deliberate tempo can generate substantial muscular engagement without the abrupt cardiovascular spikes associated with maximal efforts. Supervision plays an important role. A knowledgeable trainer or clinician can assess posture, joint alignment, and movement mechanics. They can design progressive overload plans that increase resistance gradually rather than abruptly. They can monitor for warning signs such as dizziness, breath holding, or compensatory patterns that indicate excessive strain. Technique becomes the anchor of safety. Breathing patterns are rehearsed, not improvised. There is also a psychological component to heavy lifting in later life. Some individuals equate lighter weights with decline. They may feel compelled to demonstrate they can still lift they once did decades earlier. But the physiology of aging demands recalibration. The objective shifts from proving strength to preserving it. Functional capacity, the ability to rise from a chair, carry groceries, climb stairs, matters more than personal records. When resistance training is structured thoughtfully, it enhances bone density through mechanical loading, strengthens stabilizing muscles around joints, and improves balance by refining neuromuscular coordination. It protects against falls and metabolic disease. But when maximal loads are pursued impulsively or competitively, especially in the presence of cardiovascular or skeletal vulnerabilities, the risks increase unnecessarily. The aging body does not reject challenge. It simply requires proportion. Load must be matched to tissue tolerance, progression must be patient, and breathing must remain steady rather than forceful. In this way, strength training becomes a dialogue with physiology rather than a contest against it, allowing muscles to grow stronger while the heart and spine remain safeguarded within their evolving capacity. The spine is the quiet pillar of human dignity. It allows us to stand upright, to turn toward a loved one, to bend and lift, to look forward into the distance. Yet with age, this remarkable structure undergoes changes that are subtle, gradual, and often invisible, until a careless movement makes them suddenly known. Deep spinal flexion and forceful twisting under load may seem harmless, especially to those who have practiced such movements for decades. Sit-ups, toe touches, rotational lifts, and certain yoga or gym-based exercises often promise flexibility and core strength. But in the aging body, the architecture of the spine evolves in ways that demand a more deliberate approach. Between each vertebra lies an intervertebral disc, a specialized structure composed of a gel-like center surrounded by a tough outer ring of fibrous tissue. In youth, these discs are well hydrated and resilient. They distribute compressive forces evenly and allow the spine to bend and rotate with remarkable freedom. As the years pass, however, discs gradually lose water content. They become thinner, less elastic, and more vulnerable to deformation under stress. This process is not pathological, it is biological. Yet it changes how the spine tolerates mechanical load. When a senior performs deep forward flexion, especially repeatedly or with added weight, pressure shifts toward the front portion of the disc. The inner gel is pushed backward against the outer ring. In a well-hydrated disc, this pressure may be absorbed without consequence. In a degenerated disc, the outer fibers may already have small fissures. Repeated compression in extreme ranges can exacerbate these fissures, increasing the likelihood of bulging or herniation. The risk becomes more pronounced when flexion is combined with twisting, a movement pattern that multiplies shear forces across the disc. Twisting under load introduces another challenge. The spine is designed for controlled rotation, but its rotational capacity is limited and distributed across multiple segments. When weight is added, whether in the form of a medicine ball, dumbbell, or barbell, rotational torque increases. In aging connective tissue, ligaments that once provided robust stability may have lost some elasticity. Facet joints at the back of the spine may show degenerative changes. Under excessive torque, these joints can become irritated, and small stabilizing muscles may strain in an attempt to compensate. Bone density further complicates the picture, particularly in postmenopausal women and older men with osteopenia or osteoporosis. The vertebral bodies themselves may be structurally weaker. Deep spinal flexion significantly increases compressive forces on the anterior portion of the vertebrae. In individuals with compromised bone strength, this can raise the risk of compression fractures. These fractures do not always result from dramatic trauma. Sometimes they occur after repetitive, seemingly modest stress. A routine of weighted sit-ups performed daily may gradually lower the vertebral bodies beyond their tolerance. There is also the matter of muscular balance. Many traditional abdominal exercises emphasize spinal flexion, such as classic sit-ups or crunches. While these movements activate certain abdominal muscles, they also repeatedly flex the lumbar spine. In seniors, core stability is often better achieved through exercises that promote neutral spine positioning, movements that engage the deep stabilizers without excessive bending. When stability is prioritized over range, the spine experiences less cumulative strain. Flexibility, too, must be reconsidered with nuance. Touching the toes may feel like a marker of suppleness, but aggressive forward bending can stretch already vulnerable structures. Hamstring tightness is often blamed for limited forward reach, yet in many seniors the restriction arises from protective guarding in the lower back. Forcing the body into extreme flexion may override these protective signals rather than resolve them. Gentle hip hinge patterns, where movement occurs at the hips while the spine remains relatively neutral, often achieve functional flexibility with less risk. The nervous system adds another dimension. Proprioception, the body's awareness of position in space, subtly declines with age. Complex twisting patterns under load require precise coordination. A small misalignment or delayed muscle activation can shift force unevenly across spinal segments. Repetition of such patterns, especially when fatigue sets in, increases the probability of strain. The issue is rarely a single dramatic event, it is cumulative microstress layered over time. None of this implies that the spine should remain rigid or immobile. On the contrary, mobility is essential for preserving quality of life. Gentle rotation, controlled extension, and moderate flexion performed within comfortable ranges help maintain circulation to spinal tissues and support daily function. The distinction lies in magnitude and load. Extreme end range movements, combined with resistance, introduce mechanical demands that aging structures may not accommodate safely. There is also a cultural aspect. Many exercise traditions valorize intensity and visible exertion. Deep bends and dramatic twists appear dynamic and impressive, yet the aging spine benefits more from quiet precision than from spectacle. Slow, deliberate movements that emphasize alignment and muscular engagement can strengthen the core without compressing vulnerable discs. Exercises such as bird, dog variations, supported planks, and controlled rotational movements with minimal resistance often provide stability training without excessive torque. Pain, when it appears, is often dismissed as temporary soreness, but in the context of spinal degeneration, persistent discomfort following deep flexion or twisting should be interpreted as information rather than inconvenience. The body signals strain through stiffness, radiating pain, or lingering ache. Listening early can prevent structural injury later. The spine carries not only mechanical load but the narrative of our years, the hours seated, the weights lifted, the postures maintained. Treating it with respect in later life is an investment in autonomy. Avoiding deep spinal flexion and forceful twisting under load is not about limiting movement. It is about preserving the integrity of a structure that has already supported decades of living, allowing it to continue doing so with steadiness and resilience. A fall can change a life in seconds, not because the body is fragile, but because balance is a finely tuned symphony of systems that must work together with extraordinary precision. Vision, inner ear function, joint receptors, muscle strength, reaction speed, and cognitive processing all collaborate to keep a person upright. With age, this collaboration remains intact, but it becomes more delicate. That is why advanced balance drills performed in unsafe or unsupported environments require thoughtful caution. Balance training is essential for seniors. It preserves independence, reduces fall risk, and strengthens neuromuscular coordination. However, not all balance exercises are created equal, and not all environments are forgiving. Standing on unstable surfaces such as wobble boards, foam pads, or balance discs may appear beneficial, but when introduced without supervision or proper progression, they can paradoxically increase fall risk rather than reduce it. As we age, reaction time slows subtly. This does not mean the nervous system is incapable, it simply processes corrective signals with slightly more delay. When a younger person stumbles, rapid muscle contractions restore stability almost reflexively. In seniors, the corrective response may be milliseconds slower. On a stable surface, this delay is often inconsequential. On an unstable platform, where the base of support shifts unpredictably, that delay can mean the difference between regaining equilibrium and losing it entirely. Vision also plays a critical role in balance. Depth perception, contrast sensitivity, and peripheral awareness may decline with age. The visual system provides continuous feedback about body orientation in space. In poorly lit or cluttered environments, this feedback becomes less reliable. Performing complex balance drills without clear visual cues, or in spaces with obstacles, increases the probability of misjudgment. A slight misstep can lead to a cascade of instability. Proprioception, the body's internal sense of joint position, changes over time as well. Receptors in muscles and transmit information about limb placement to the brain. With aging, these receptors may become less sensitive. As a result, the brain receives less precise data about where the body is in space. Advanced balance exercises that demand rapid shifts in weight or multi-directional movements rely heavily on proprioceptive accuracy. When this system is less responsive, the margin for error narrows. There is also the influence of muscle strength and coordination. Small stabilizing muscles around the ankles, hip, and core are essential for maintaining posture. In many seniors, these muscles have weakened due to years of reduced activity or natural muscle loss. When placed on highly unstable surfaces, the demand placed on these muscles can exceed their current capacity. Fatigue sets in quickly. Once fatigue appears, neuromuscular control diminishes, and instability load is another often overlooked factor. Complex balance drills sometimes require simultaneous tasks. Catching a ball while standing on one leg, turning the head while maintaining stance, or responding to verbal cues. Divided attention can strain cognitive processing speed, which may decline modestly with age. When attention is split, balance control can suffer. A moment of distraction during an advanced drill may lead to loss of footing. Environmental context matters deeply. Practicing advanced balance exercises without sturdy support nearby, such as a wall, rail, or stable chair, removes a critical safety net. Even a minor slip can escalate quickly when there is nothing to grasp. Hard flooring surfaces further amplify risk. Unlike supervised rehabilitation settings, home environments may contain rugs, uneven surfaces, or furniture that obstructs recovery from a misstep. It is important to emphasize that balance should absolutely be trained in later life. The nervous system retains plasticity, it adapts to challenge. Gradual progression improves coordination, strengthens stabilizing muscles, and enhances confidence. The problem arises when progression skips foundational stages, attempting single-leg stances on unstable devices before mastering them on firm ground introduces unnecessary hazard. Effective balance training for seniors often begins with stable surfaces and simple movements. Weight shifts from side to side, controlled heel to toe walking along a straight line, and simple single-leg stands build foundational stability. As proficiency improves, complexity can be added slowly, perhaps by reducing hand support or introducing mild surface variation while maintaining a secure environment. The principle is progression without compromise of safety. Confidence also plays a psychological role. Fear of falling can alter movement patterns, leading to stiffness and reduced natural sway. Ironically, excessive anxiety during advanced drills may impair balance more than the instability itself. A safe, supportive environment fosters calm concentration, allowing the nervous system to learn effectively. When seniors feel secure, they engage muscles fluidly rather than defensively. Falls are among the leading causes of injury in older adults, often resulting in fractures, hospitalizations, and loss of independence. Many of these incidents occur not because individuals avoided exercise, but because they misjudged risk during activity. The intention to improve balance must be matched with structured design. Supervision by a trained professional, especially when introducing unstable surfaces or complex drills, significantly reduces danger. The body in later life still possesses remarkable adaptability. Reaction time can improve with practice, strength can increase, coordination can sharpen, but improvement occurs most reliably when the challenge slightly exceeds current ability, not when it overwhelms it. Advanced balance drills performed prematurely or in unsafe environments do not accelerate progress, they gamble with it. Safety is not a retreat from growth. It is the framework within which growth becomes sustainable. When balance training is grounded in careful progression, environmental awareness, and respect for sensory changes, it becomes one of the most powerful tools for preserving mobility. When pursued without these considerations, even well-intentioned exercises can undermine stability rather than strengthen it. There is something deeply admirable about endurance. The ability to walk long distances, cycle for miles, or participate in demanding cardiovascular events represents vitality and determination. Many seniors carry a quiet pride in proving that their stamina still rivals their younger years. But endurance, like all physiological capacity, evolves with age, and when extreme efforts are introduced suddenly or without adequate conditioning, the cardiovascular system can become strained rather than strengthened. The heart is a remarkable muscle. It contracts rhythmically thousands of times each day, adjusting output to match the body's needs. In youth, the heart muscle is highly compliant, meaning it fills and pumps with flexible efficiency. Blood vessels are elastic, expanding and recoiling to regulate pressure smoothly. With advancing age, subtle structural changes occur. The heart muscle may become slightly stiffer. Arterial walls gradually lose elasticity due to changes in collagen and elastin fibers. These shifts do not prevent effective circulation, but they alter how the cardiovascular system responds to sudden, intense demand. When a senior abruptly engages in extreme endurance efforts, such as running long distances without progressive training, participating in high-intensity cycling events, or performing prolonged aerobic sessions beyond habitual levels, cardiac output must increase significantly. Heart rate rises, stroke volume adjusts, and blood pressure can elevate. In well-conditioned individuals, these changes occur within safe margins. However, if conditioning has not been built gradually, the sudden stress may overwhelm the heart's adaptive capacity. One area of concern is arrhythmia. Age-related changes in cardiac conduction pathways can make the heart more susceptible to irregular rhythms under stress. Intense endurance efforts increase sympathetic nervous system activation, the body's fight or flight response, releasing adrenaline and other catecholamines. These hormones accelerate heart rate and increase contractility. In susceptible individuals, this surge can trigger abnormal rhythms. While many arrhythmias are benign, some may cause dizziness, palpitations, or more serious complications. Blood pressure dynamics also shift during extreme exertion. Stiffer arteries resist expansion, leading to higher systolic pressures during intense activity. For seniors with hypertension or underlying vascular disease, these elevations may strain arterial walls. The risk is not limited to dramatic outcomes. Even transient spikes can contribute to cumulative vascular stress over time. Hydration status becomes increasingly significant as well. Aging alters thirst perception. Seniors may not experience strong thirst cues even when mildly dehydrated. During prolonged endurance efforts, fluid loss through sweat can lead to decreased blood volume. Reduced plasma volume forces the heart to work harder to maintain adequate circulation. Electrolyte imbalances may develop, further increasing susceptibility to arrhythmias and muscle cramps. What begins as a spirited long-distance effort can gradually become physiologically destabilizing if hydration and electrolyte balance are not carefully managed. Inflammatory response is another important factor. Intense endurance exercise triggers microdamage in muscle fibers and elevates inflammatory markers temporarily. In younger individuals, recovery systems restore equilibrium efficiently. In seniors, inflammatory resolution may be slower. Prolonged or repeated extreme sessions without adequate recovery can create a state of chronic low-grade inflammation, which has been associated with cardiovascular disease and metabolic dysfunction. There is also the matter of recovery time. After demanding aerobic exertion, the body must replenish glycogen stores, repair tissues, and rebalance autonomic nervous system activity. Heart rate variability, a marker of autonomic balance, often decreases after extreme exertion and requires time to normalize. Seniors typically need longer recovery intervals between high-intensity efforts. When recovery is insufficient, cumulative fatigue can impair immune function, increase injury risk, and diminish overall vitality. Importantly, moderate endurance training remains profoundly beneficial in later life. Regular walking, swimming, cycling, or light jogging performed at sustainable intensities improves mitochondrial efficiency, enhances insulin sensitivity, lowers resting blood pressure, and supports cognitive health. The distinction lies in intensity, duration, and progression. Cardiovascular fitness develops through incremental overload, gradually increasing duration or intensity so that adaptation occurs without overwhelming the system. The psychological dimension must also be acknowledged. Some seniors feel compelled to demonstrate resilience by participating in marathons, triathlons, or extreme fitness challenges without adequate preparation. While goals can be motivating, they must align with physiological reality. The body at 70 is not the body at 30, even if determination remains unchanged. Wise training respects that difference without diminishing ambition. Gradual conditioning allows the heart and vasculature to adapt. Endothelial function improves, stroke volume increases, and oxygen utilization becomes more efficient. These adaptations reduce resting heart rate and improve exercise tolerance safely. Sudden, extreme demands bypass this adaptive process, asking the cardiovascular system to perform beyond its current conditioning. Environmental factors compound risk. Heat exposure during prolonged outdoor events can increase dehydration and cardiovascular strain. Cold temperatures may cause peripheral vasoconstriction, elevating blood pressure further. Seniors may be more sensitive to these environmental stressors, particularly if taking medications that influence fluid balance or heart rate. None of this argues against endurance activity. Rather, it emphasizes thoughtful progression. Pre-participation medical evaluation can identify underlying conditions. Structured training plans that build duration gradually allow tissues and the cardiovascular system to strengthen incrementally. Monitoring perceived exertion rather than chasing arbitrary performance metrics keeps effort within safer limits. The aging heart is capable, adaptable, and resilient when respected. It responds beautifully to consistent, moderate challenge. But when extreme endurance efforts are introduced abruptly, especially without preparation, the balance between stress and recovery tilts unfavorably. In later life, sustainability becomes the true measure of fitness, not the distance covered in a single day, but the capacity to remain active, steady, and well supported by a cardiovascular system that is challenged wisely rather than overwhelmed.